My name is Gasia Mikaelian, and I'm a reporter at KTVU Fox 2 News in the San Francisco Bay Area. I am so happy to welcome to this discussion Gwen Haynes, a certified nurse midwife, co-owner of Golden Oak Midwives in the Bay Area as well. Thanks for being with us, Gwen.
Thank you, Gasia.
Let's talk about your experience you had in just the past week or so. You delivered a baby at a hospital. I imagine it was a lot different than what you've been used to.
I would say the main difference is the support system has changed for families because now only one support person is allowed at Altabates for women in labor. This is to say, I just want to make certain that people know they're still very well supported in their labor. The nurses are outstanding. Many families have hired a doula, and we cannot sing their praises enough in terms of helping women at home prior to arriving at the hospital. One of the major differences, I would say, is there's a temperature screening that's happening at the front doors before you walk in, and a quick health assessment. You know, do you have a fever, cough, sore throat? And then everybody is wearing masks, surgical masks, the nurses, the doctors, even family members, support people, and the laboring woman is now being required to wear a mask. So that is much different than it was even 10 days ago.
I know that you help women and really families in the long months leading up to the day the baby is born. I imagine you've been working with women before the coronavirus pandemic really surfaced. When you give them the news that, look, you can't have your husband and your mother and your sister and your best friend at the bedside when you deliver, how do the women take that news?
Well, I try to frame it a little bit differently and know that they're going to be well supported throughout the course of their labor. They're going to have the support team they want in place when they're home, and then we are going to be their support at Altabates. And the nursing staff is wonderful also. So I'm trying to reassure them they're not without support. Their support system has changed a little bit in terms of what part of their labor they're going to be able to be present. And then it also leads into what happens after the baby, because that support system is now different also. Because people who are planning to have family come in from all over the country to be with them, to cook meals, you know, to help with the baby, that is shifting also. So we sort of talk about from the beginning of pregnancy, but really anticipating what the birth is actually like in terms of how that support is going to shift, and then also in postpartum.
I know it's been more than a few years since I had my two little boys, but I do remember immediately after the birth, it seemed like we were going to the pediatrician's office almost weekly to care for the child. And then myself, you have your 6-week checkup. I mean, mom is going to the doctor a lot too. How has that changed?
So for Golden Oak, we have a wonderful midwife that doesn't participate in birth with us, but she does a home visit during that first week. And that is continuing to happen for our practice. So for us, that is helping people feel comfortable, mostly just a weight check on the baby and to make sure that breastfeeding is still going well. By and large, the pediatrician groups in our community want you to bring your baby in for the well visit. It's still important. And also to really also think about vaccinating your kid if that was something that you wanted to, delay or think or do it differently. Really, right now is the time, to probably really listen to your pediatrician's advice around that. Many of the pediatrician offices, including ours, so we're doing, visits more telemedicine just like everybody else. So our colleague is coming to the house for the first week, and then we do a 2-week telemedicine appointment, but always have access to us anytime during that time.
I've talked with a couple women and couples who say, we were hoping to get pregnant sometime this spring, or we were thinking of starting or adding to our family. And now they're sort of pulling back, saying, I don't know that now's the right time. What do you have to say to those people going through that thought process?
I think it is challenging. I've talked to many women in the last couple of weeks who've just found out they were pregnant. And, there's concern about protecting the pregnancy now, anticipating what it's going to be like 9 and 10 months from now, when we don't even have the answers of what it's going to be like a week from now. So just trying to be reassuring, but also know that we don't have all the answers and we don't know. Women who are pregnant in their first trimester in China, where this began, are still pregnant. So we don't have all the answers in terms of how potentially could impact the pregnancy. Although what we do know is that it does not seem to pass in breast milk, and it does not seem to impact women who've become COVID positive in their second and third trimester in terms of birth outcome.
Good. Okay. Well, that's two important good pieces of news. Can we talk for a minute about the overall stress and the effect that can have, especially on a pregnant woman and her baby? I mean, it is undeniable. I know that you have a family. I know that, you're the co-owner of a business. So you're working, you're being a mom, you're also being, a home teacher. There is no one whose life hasn't changed dramatically. If you add to that a pregnancy, I just imagine that stress level skyrockets. Can you talk about the effect that might have on the mother and also on the baby?
Well, I think that in general, our bodies protect our pregnancies very well. And, people all over the world live in different life circumstances than we do here in the Bay Area. And our bodies want to protect and take care of pregnancy. So I feel like the stress of being pregnant really deals with the whole mental health piece for all of us, in that we need to take good mental health care of ourselves. So that means going outside every day. That means getting vitamin D. That means exercising our bodies, touching base with our loved ones. Those are the things that we all need to do, not just specific to pregnant women. And so we are really pushing that. We're getting, people to have access to online yoga classes and to be able to Zoom in with us. I know that other practices are doing the same. So mental health is really important, both in pregnancy and then for all of us, really, to be able to sort of sit where we are in this moment and then be able to manage it a little bit more long term.
Because I know, I think back to when I was pregnant, and especially with your first pregnancy, right? You worry about everything. And in a way you feel like you're doing something by worrying, but in reality, does the baby, feel that stress?
There has been research about cortisol, which is a hormone that is released during pregnancy. And I think the jury's out about how it might impact a baby. I think in general, mental health, is something that we all need to consider. And I don't think that worry is going to impact your pregnancy in a bad way. I just think that it can just impact all of us in a bad way if we don't do things sort of to create better. So we,
I
recommend not watching the news 24/7.
I understand.
Being outside, to limiting, to also try to think about what are the silver linings? What are the things that are positive about this? There is something about sheltering in place that has a sweetness to it in terms of being able to spend time. But there is that isolation piece that we do worry about both in pregnancy and then the immediate postpartum.
Right. No, I agree. I mean, like you, I have a young family. I'm also working from home. But, sometimes when I'm at my crankiest, I just tell myself, look, we have a roof over our head. We have food on the table. All four of us are together all day. Like, we should be thankful for what we do have, because not everyone is in that fortunate of a position.
Yes, absolutely. We definitely tell that to our families also. And I would say that I am really proud of not just the families that have chosen Golden Oak for their care, but the entire Bay Area community for sheltering in place, because it has really made a difference for all of us. And I am really thankful, because I definitely feel like we've been bracing for a big surge or a medium surge, and we keep waiting. And so the more we keep waiting, the better. So all the work we're doing in terms of sheltering in and figuring out ways to do that in a healthy way, we're all connected in a way that now is totally obvious in a different way. So thankful for that.
I like that perspective. I like the looking for the silver lining. Gwen, thank you so much for joining me today. I wish for you and the families that you help, beautiful births and healthy babies and healthy mothers and healthy families. When we talk about essential workers, you are one of them, because you're shepherding new life into this uncertain world. But we have to think ahead to the beautiful days that are in our future.
Thank you, Gasia, for having me. I appreciate it.
Of course. Again, thank you to Gwen Haynes, certified nurse midwife, co-owner of Golden Oak Midwives in the San Francisco Bay Area. For more information on this topic and others, you can visit coronavirusnow.com.